The MILESTONE Project is a 5-year research project funded by the European Commission, and it runs from 2014 to 2019. The project addresses the problem of transition from child to adult mental health services across different healthcare systems in Europe.
Child and adolescent mental health care is of special relevance for public health, because when we talk about needs of care for people who are very young and are in a way at the start of their lifetime trajectories, we speak about problems which can affect, and in fact in many cases do affect, the developmental pathways of individuals, and so they can either destroy or worsen, or in most positive cases improve the lifetime course of individuals. So I think that this is a very important phase of people's life in which if they have any needs, as it happens, these needs must meet appropriate, timely and effective solutions.
Our consortium consists of 12 partners from 8 different countries, and we are either researchers or mental health experts, and we are all interested in young people's mental health and their experiences of transitioning from children's to adult mental health services.
In the MILESTONE study, we have identified just over 1,000 young people from 8 European countries who've arrived at the boundary of their child psychiatry care. And we are going to follow their journey across to adult services. One subgroup of these 1,000 young people will receive a package of care which we call managed transition. It's simply a tool to help clinicians make a thoughtful and considered decision on whether the young person should have transition to adult care. So we will have information on 1,000 people as they make their journey to adult services. Within that, a subgroup who will receive a model of managed transition, and we will see whether our intervention of managed transition improves their experience of care, their outcomes, their well-being into adulthood. Child psychiatry and adult psychiatry have developed under very different historical pressures, and they have developed in very different ways on how mental disorders or emotional difficulties are understood and how they should be treated. So the barriers between these two services are clinical, they're ideological, they're organizational, they are conceptual. It is in fact quite surprising that within the same discipline, a young person can get very different form of care depending on whether they go to child psychiatry services or adult services.
There's lots of challenges that young people have to face during transition, and in my experience one of the biggest challenges was the lack of information and knowing what different choices are out there. Services often seem to vary so much around the country, and it can be a bit of a postcode lottery as to what service you will get.
We know from research that has been conducted in England, in Ireland, in many countries, that sadly for a lot of young people the experience of transition is a negative one. It's poorly planned and executed, and the young person has difficulty engaging in subsequent services. From the perspective of CAMS, the difficulties are that they're not knowledgeable enough about what adult mental health services offer or what sort of referrals they will actually take on. And even when they perceive the young person has an ongoing mental health need, they actually don't refer the young person, and that's based by research that we have carried out.
Transition has to be a gradual, slow process which is appropriate to the developmental needs of that young person. And in today's frenetic clinical environment, it's very difficult for clinicians to find the time and resources to plan that in a careful manner.
Some very important issues with transition planning is that often the young person is not really informed about it. They are not part of the decision making, and therefore it comes as a surprise, and then the young person goes to a new clinician in the AM service, and then they start from scratch asking them all the information that they've already given to the CAMS services.
Challenges that I think young people face are not being included in the decision making and being rushed to different services that might not be appropriate for them. And I think that sometimes you have to beg services and clinicians to help you to find the service that you think you deserve, and you should be supported throughout the decision making process. I've had direct experience with transition which didn't work out very well, so I was excluded from the decisions that were made for me about my transition. So I was determined to try and not have the same mistakes happen that I had with other children and young people. So Milestone was a good international platform for me to tell my story and highlight the need for research and changes within services.
Well, from my experience, I was told that I wouldn't meet the threshold to move to adult mental health services, even though everyone in the service I was in CAMS, thought that I still needed support. So it felt like the onus was on me really to go and find that support, and that was difficult.
There are a couple of things that can make transitions easier. This includes being given information, given the time to prepare for the move to adult services, and not being rushed, and really being made aware of the different options available to you.
Yeah, I think hearing about other young people's transitions, and especially if they were positive transitions, that would have been helpful, and being reassured really that things will work out.
The project is a real milestone because it's going to solve, hopefully, a problem that everyone has spoken about, but nobody has done anything about.
There is an urgent need to make possible that these two care sectors start being linked, start communicating between them, and start making concerted actions for the sake of children and adolescent health and mental health.
We hope very much that we will come up with a solution that will radically transform the care and experience of care for young people in this very vulnerable age group. Most people don't realize that when young people are at the peak of their physical power, they are psychologically the most vulnerable. Transition period is the time when most serious mental disorders begin.
It's a unique opportunity to study a large cohort of children longitudinally from many different European countries and examine those that have optimised transition, managed transition from child to adult mental health services, and more importantly looking at their outcome and seeing how they do.
I think it's a real milestone because it is for the first time the young person's view is taking primacy over just the clinician's view.
It's really beneficial for young people to get involved in this kind of research, and it can impact on other young people further down the line with the results that we're collecting, and make it really relevant to young people that are using services.
Yeah, I agree with Amanda really. This research will provide a much bigger picture than we've had before about transition.
Professor Pat McGorry, who is one of the leaders, international leaders of youth mental health, once said that the way the current system is creates a weakness in the care pathway where it should be the strongest. Milestone can really change that and make the system strong and robust just where it should be, that to meet the needs of our young people.